Okay. Next, I'd like to invite Rabbi Richard Address to come and address us about healing and advanced care. And he is the founder and executive director of JewishSacredAging.com, which is a project that's been responsible for creating awareness and resources for congregations on the on the implications of the emerging longevity revolution, with emphasis on the growing baby boom generation. He has served for over 3 decades on the staff of the Union for Reform Judaism, first as the regional director and then beginning in 1997 as the founder and director of URJ's Department of Jewish Family Concerns. He's also served as rabbi in congregations in New Jersey. And he hosts a weekly radio show, and he's also the author of numerous articles, book chapters, and books related to the issue of aging. So we're really thrilled to have him here with us. He's also involved with the Coalition to Transform Advanced Care. Thank you.
Thank you. Good morning. How are you?
Good morning.
Thank you for this invitation. And again, on behalf of CTAC, we want to invite you to, as you go through this day, piggyback on what John was talking about, to really give some thought about how you and your organization can be involved in this very, very important work that we're all involved with. So again, thank you for this invitation. My job with you is in the next 15 minutes, and hopefully 20 minutes. So hopefully that's not a rabbinic 20 minutes. Which you know could stretch to a couple of hours, but don't worry. I have a class to teach at our seminary in a couple of hours. So my assignment with you is to talk a little bit about healing and advanced care. So as you all know, there are no guidelines for healing. There are no stages we can conveniently quote. Many of us in this room know this, for we have seen it, we have lived it, and if we've been blessed, we have participated in it. Healing is personal. Healing is private, part of the mystery of our existence. Healing, a spiritual healing, a healing of the soul, can come at any time, even as the last breath of life ebbs. Even if there is no cure, the healing of a soul is always a possibility. That is why in our tradition, a daily prayer states, "Heal us and let us be healed, save us and let us be saved. Grant full healing to every illness, every wound and pain. Blessed is the Eternal who heals the sick." And likewise, we have this other wonderful prayer called the Mishaberach in Hebrew. It's a prayer for healing that is recited in just about every synagogue on every Sabbath. And it asks for, in the Hebrew, a refuat hanefesh and a refuat haguf, a healing of the spirit, and then a healing of the body. Notice the order. A spiritual healing precedes that of the body. The writers of this prayer so many years ago understood that healing is always possible, even in the face of certain death. What does it mean to be healed? In the varieties of religious traditions represented here in this room, each has a pathway that embraces and holds the individual as they search for that often elusive sense of wholeness. A spirit that may be broken by illness and fragmented by despair and depression searches for a sense of completeness. We call it in Hebrew a condition of shleimut, of wholeness, of oneness, of completeness. And yes, that is a word that is derived from its root of shalom, of peace. It is this search for peace that we discuss today, a search on which each of us in our own way is engaged. Sadly, it too often takes an illness to bring this search to the forefront of our conscious self. But make no mistake about it, we are all on this search. trying throughout our entire life to answer God's most profound question, the first question that is asked of us in Scripture in Genesis chapter 3, Ayeka, where are you? Let me speak to you of Bill, a man in his early 50s whose cancer after remission began to spread. It spread to the extent that he and his family were given a choice about a year ago to engage in some advanced treatments that would extend his life by perhaps months, maybe more, or refuse these very aggressive treatments and return home to finish his life. He chose the latter. Bill came home, went under hospice care, and began to deal with what was his eventual outcome. His weeks to live became months. His anger and resentment gradually were replaced by an acceptance of his reality. His conversations with his friends, his sons, his grandchildren, his wife, who was constantly in his life, encased Bill in a cocoon of love. And his healing, he learned. And he taught the following. This is his words that I asked him to write before he passed away, that we published on my website, JewishSacredAging.com. This is what he wrote. I have also learned that there is no right or wrong way to handle this illness. It is up to the patient to write their own story. Just because I chose to be open about my illness does not mean that it is right for everyone. I have also learned that the value in life is not money, but the legacy one leaves behind. I truly believe that my sons have learned that marrying the right person and having the right set of values is essential to leading a good life. It has been 5 weeks, and I am still alive. Some days I feel that I am a burden, but my wife has convinced me otherwise. I have had the opportunity to meet and play with my 2 granddaughters and say my goodbyes and reflect upon my life. I have also witnessed the depth of love of my family. That is something many people never receive, and for that, I feel fortunate. I raised Bill's story as an example of healing in the face of certain death. Every clergy person and doctor and medical social worker, nurse, and the like has been a part of a Bill-type experience. And truth be told, we have also been part of the opposite. The ability to support another human being on the final stages of life's journey is enhanced by the power of presence, the gift of love, and the support of a community. This is what I refer to as a theology of personal relationships. It is a challenge in our contemporary society, for too many people are ushered into that last stage of life alone, isolated, and devoid of prolonged human contact. It is hard to be healed in isolation, alone, without a community. A touch, a kiss, a loving voice is as important for many as a machine or another test. In our tradition, texts exist that speak to the challenge of relieving the pain of a dying patient, in which the context of a case, always the determining factor, will allow for the flame of life to be flickered out in dignity and in sanctity. There is little support in our tradition for a life ending in pain and suffering. In the context outlined in our tradition, the Jewish tradition, the higher mitzvah or deed may be to focus on the dignity of life rather than futile, aggressive treatment. This focus on futile medical treatment was the subject of an op-ed in last Friday's New York Times entitled, "When Medicine is Futile." It was in many ways a commentary on the Institute of Medicine's report last week, which validated what we all know and what Dr. Victor Zal stated in the Times piece last Thursday: people don't die in the manner they prefer. Thankfully, with the Institute's reports, the work of organizations like CTAC, the dialogue may be shifting to a re-examination of this issue. Perhaps changing the focus from how to die to how to be healed. For this is the concern of religion, not how a disease occurs and what its impact may be. Rather, we want to look at the why. For it is in the search for the why that personal healing can take place. It is in this search for the why that the power and place of a religious community in a person's life can make a significant difference. Each religious philosophy contains within it beliefs and rituals that can help a person be healed, even in the face of death. It is in this search that individuals and families often reconcile past differences, reach a new understanding, allow for communication to take place in ways that never were possible, and remind all concerns that in our humanness, we are also part of nature, not above it. And in that reality, we become part of something greater than our own self. It is a reflection really on that first chapter of the book of Ecclesiastes, a dynamite chapter, by the way, in which we come to know this image of the river flowing into the sea, that we are all part of an eternal flow of time and space, and that our sense of meaning is derived from how we choose to see ourselves in the context of nature's ebb and flow. Healing and advanced care then can be a partnership forged between a person, a family, and a medical professional. A partnership that is embraced by a person's search for their own answer to that question in Genesis, why? The late Rabbi Abraham Joshua Heschel discussed the potential partnership of healing and caring. Heschel gave a speech entitled "The Patient as a Person" to the convention of the American Medical Association in June of 1964. It's 50 years ago. Okay? The Rabbi Heschel of blessed memory gave this speech. If you ever can get this speech, it's printed all over the place. Get it; it'll blow you away. 50 years ago, that we still haven't figured it out. That's an aside. In this speech, he spoke of the linkages in the sacred context between the physician and clergy. Quote, listen to this, you'll love this. The doctor is God's partner in the struggle between life and death. Religion is medicine in the form of prayer. Medicine is prayer in the form of deed. The act of healing is the highest form of imitatio Dei. To minister to the sick is to minister to God. Religion is not the assistant to medicine, but the secret of one's passion for medicine. Unquote. Great essay. Go get it. And if you're teaching, if any of you are teaching, and this is a great, in medical schools especially, this is a great essay to give as a text for a class discussion. And it's 50 years ago. I think it is important to celebrate the fact that it is due in large part to medical technology, that our discussion really this morning has even taken place. The doubling of lifespans within the last century has been a product largely of medical technology, public health advances, and a greater awareness, especially lately, of the role of lifestyle choices. In many ways, I think you can make the argument that the gift of time that we have been given has been the gift that has allowed us to contemplate our own sense of meaning. And in the light of advanced care, that time can be the catalyst for a level of personal healing that was never possible until our contemporary times. This gift of time raises the stakes in a sense that it makes the dialogue on the issue of how to deal with the impact and reality of advanced care to a new level. The importance of having conversations about one's wishes has never been more important, and gradually that wave is spreading. and religious institutions can be a major player in this wave where they have the ability to teach and program from a perspective of faith and the reality of a supportive community. It is never easy to create dialogues and discussions on how one wishes to die. The discussions themselves can be a factor in one's healing process, for it is often in the context of those discussions that a person can come to see his or her life in review, to be reminded of the love of family and friends, and to say things that have often gone unsaid. Likewise, and this is equally as important, these conversations can afford the rest of the family, often the caregivers, an opportunity for their own healing. We often are so concerned with the person whose life is ebbing that we forget that the people who care for that person are also in need of their own healing. The residual feelings of a loved one who had to make a decision about life support or increased use of drugs is part of the healing equation, and they cannot be allowed to be forgotten. This discussion of healing and advanced care has already begun to be seen in a larger context. And I think this is where the legacy of Rabbi Marshall Meyer comes into play. For the issues of advanced care and how the costs of those care impacts families and society may very well be one of the great key social justice issues for the next decade. The economics of aging is a subject that seems to paralyze politicians, paralyze them into inaction. The concept of healing as it relates to advanced care needs to include serious conversations about how the society makes that healing possible. That issue is a social justice issue that impacts not only our generation, but our children's and our grandchildren. The ethical issue of who and how we pay for this care, the care we need, is not a fantasy question. It is very real, and it is very present. Every single one of us in this room knows this for a fact, and I would be willing to bet my Phillies tickets, worthless as they may be. I'm from Philly. That many of us in this room have had to walk this walk. We are being told by the United States Census people, and you know the government does not lie, that 10,000 people a day in this country are turning 65. We are being told that as of this year, 2014, every single baby boomer that is now alive is at least 50 years of age. Caregiving experts tell us that there may not be enough qualified caregivers to take care of boomers as we age. And we are already seeing the first wave of the caregiving conundrum as boomers scramble to find qualified caregivers or locations to take care of their parents. The economic impact of the social revolution has caused some economists to sound a call of alarm. Dr. Lawrence Kotlikoff of Boston University, in his latest book, The Clash of Generations, warns us of the fact that the demographics of aging is becoming, quote, a generational clash, because the economy that supports the elderly and their medical care is not growing as fast as the elderly population and their medical needs. Kotlikoff also goes on to voice his concern that unless radical change is brought about in the very near future, we may be encumbering future generations with a caregiving debt that may be impossible to sustain. Quote, in most contexts, he writes, longer lives signal a successful society, something evoking pride, not panic. But for us, the success is starting to look catastrophic. An awful fear is starting to creep up the backs of our necks as we confront the longevity rub. We aren't willing to pay for those extra years of life. We don't want to save more as individuals. Our employers are no longer willing to take care of us when we retire, and we don't want to pay more in taxes, unquote. The debate and discussion over the economics of aging and the impact of those economics in our society will surely continue to be one of the most fluid discussions that we will witness in the coming years. And I have no doubt that the Wall Street Journal, CNBC, and the like will regale us with facts, stats, and charts. For us, however, it is equally about that man or woman who may lie on a bed of pain, agonizing with a family over the necessity or not of a course of treatment. It is the human face of those charts and statistics that we cannot ever afford to forget. It is also important that we do not get so caught up in the political debates over these issues that we also lose focus on the fact that ultimately we are talking about people's lives and how to make the last years ones of dignity and sanctity. Likewise, as we move forward into this uncharted future, we need to be cognizant of another reality in our society, that of diversity. America is changing, as it always has. Our strength in many ways is our diversity of cultures. Not every culture chooses to see life's ending the same as others. Part of our challenge in discussing healing and advanced care is to be aware that different peoples may see these issues through their particular cultural eyes, and it may not be moral or ethical to impose one view of healing and caring on everyone. The discussions today, then, are part of this larger and growing dialogue. A dialogue with partners in caring on how to make the passage from life a journey of dignity and sanctity. Awareness and education, openness and courage may all come into play as we move forward. Yet in the end, I have a feeling that as we look at each case on its own context, we may come to know that true healing can take place through the power of our presence, the support of our community, and the embrace of the power and passion of love. Thank you very much.